We're back. Yes, Paula. Got the plug, Sunshine Fund. I was just in the Cafe WATR lounge and talking to my colleagues, and she goes, no, we put a plug on your show, don't worry. Okay, so let's get back to the meat. Medicare. Lots of changes out there. If anyone has a question, Brian's not on the phone now. You can just ask for yourself. For HIPAA reasons, don't say your name. 203-757-1320. Okay, so what basically has just transpired is from October 15th through December 7th, there were seminars all over the state. Things were good, actually. I cannot say enough. And don't judge a book by its cover. Another great lesson I have to learn. So they have us at the Cocoa Keys. They have us up in Torrington, down at the Marriott in Trumbull. And so anyway, they had me at the Mattituck Senior Center, and it was packed. 70 people showed up. And it's in the basement, by the way, of the building. And I'm like, I don't know if anyone's going to show here, but they rocked it. So for my friends out there, I sincerely appreciate all your kindness, your kind words. They were always with a fresh smile. And I did actually get a Fig Newton once in a while. I took it. A little hungry. Sometimes I didn't even have lunch for 3 or 4 days in a row during the busy season. I didn't even have lunch. Diana probably liked it. I maybe lost a pound or two, which I don't know. Did I need it? Anyway. Okay, so most importantly, if you're happy with your change, great. If you are getting anxiety about buying a Medicare Advantage plan and you're being told that you've given up Medicare and that the whole world is going to implode and the fiscal cliff is going to get you and everything, and you just can't handle what you've changed, what you can do is you can always, from January 1st through February 14th, it is referred to as the Medicare Advantage Disenrollment Period. And what that means is the Medicare Advantage Disenrollment Period means you can make a change back to original Medicare. And what that means is you can go back to your Medicare supplement and pick up a prescription drug plan. Now, another thing, I don't know how, but I enrolled quite a few veterans this AEP, and the veterans are noticing that they've got their trump card. They've got their Part D with the Veterans Administration, the VA, and they're saying, well, you know, I really don't have a local chiropractor. I don't have a local podiatrist. I always have to go to West Haven or to Dr. Chai Chai and Dr. Molina at St. Mary's. So they're finding that the Advantage plan was nice because they don't lose their VA coverage. Most of them have a 0 monthly premium, and it gives them added benefits that they might not have had unless they actually paid for cash out of pocket. Blood labs. Aetna was good. You could use Quest with them. For United Healthcare, it's LabCorp. If you have any questions, just call in on that. I can explain the differences between those two. Remember Anthem, which is owned by WellPoint, WLP for the stock market chasers. If you were in the plan conundrum of catastrophe, that they dropped the plan. The letter stated, thanks for your business. We're canceling your plan. Go find another one. So if that was you, you do have plenty of time all the way until February 28th to make that change. It's very, very simple. Also, I'd love to announce, and I'm sure I did it on the last show, but let me reiterate it again, the fantastic staff at Dr. John Keggy, not Chris Tapp Keggy, John Keggy, has joined United Healthcare. It took years to get this gentleman to join, but from the bottom of my heart, I sincerely appreciate it because, as you know, listening to me, I sell Anthem, United Healthcare, Aetna, and Connecticut. And it was always a tough position when someone said, well, Dr. Keggy and Dr. Kennan, another rock star over there, they're not in the network. So you always had to just pivot right to the other carriers. But now the playing field's leveled a little bit, and it is nice. Connecticut continues to be a 4.5-star rated company. Congratulations to Matt Gallagher, Lisa O'Hara. and all their hard work over there, Bill Gary. It's a good product. They kind of shot themselves in the foot a little bit this year. They raised their primary care physician copay to $20, and then they changed their specialist to $50, which is just high. Aetna had a good, strong showing this year, but please remember it's not Silver Sneakers associated with Aetna. It was referred to as Silver and Fit. Okay? United Healthcare had a good, strong showing. You have to buy the Silver Sneakers. It's $13. You can add it right on the phone. If you have a question, just call in. I'll give you the phone numbers. All right, another thing. People are calling off the hook at the agency. They want to know about their Silver Connect card. So if you can't reach the fantastic people at WC AAA, Western Connecticut Area Agency on Aging, my friends Richard Wood, Daryl Willenbrock, Carla Maselli, Heather, thank you so much for speaking highly of me, by the way. People tell me that you do. You can always reach them at 757-5449 and just get your Medicare card out and your Silver card, give them your information, and they could look you up. But if you can't reach them, you can always call customer service at the Department of Social Services. Their phone number is 877-485-6777. 5 people were laid off from the Department of Social Services for basically slacking. Let's call it what it is. They had boxes of applications being pending, and no one was moving on it. So, unfortunately, people got let slip through the system. And also another thing, there's an agency out of Florida called Social Services. They were doing a lot of calling to my clients, and my clients are saying, you know, is this a scam? It's actually not a scam, but if you're a client of mine or you're a listener of mine, it's better just to go through the local agency on aging or me to get the QMB. It's seamless. It's just easier. So let's brag again about how fantastic our Office of the Healthcare Advocate is. They are working with Kevin Cunahan on the exchange. The exchange will be up and running October 2013, but only in a test period. It will be official as of January 1st, 2014, and you can read about it in the paper almost every day, where they're going to be given a choice of benefits, just like, you know, anything like a menu at a restaurant. You're going to be able to buy the gold, the silver, the bronze. I think the top one's the platinum. Platinum, gold, silver, bronze. And it's funny, Kevin Cunahan's wife was actually the woman who implemented the names. All right? I hope everyone saw the producer Nick's YouTube page, especially producer Nick. I've gotten several calls from Carmody and Torrance. My friend Chuck Stoller said, what a phenomenal job you did. They're actually using producer Nick's YouTube video on their website, carmodyandtorrance.com. Producer Nick, let our he doesn't even need any headphones anymore. I love the guy. He is going to, one moment, he's saying, Michael, I need a second with the cameras. He is going to explain how you can watch it. And please watch it. They're up there. We've gotten... I'm not really a big social media person. I've never done in my life Facebook. I've never even typed the word in. I don't tweeting. I don't tweet. Birds tweet. I don't tweet. We got a caller on line 1. Put him through. Michael Regan. Producer Nick, you're here. Michael Regan, how can I help
Ferris,
you?
The question about the insurance exchange.
Hey, Ferris, great to hear your voice.
Same here, Mike. I just heard this morning that Pennsylvania has several actions pending to do away with and not get involved with an insurance exchange in that state. Also, Arizona, Mike. Are you aware of any actions in Connecticut?
Florida, Arizona, and Pennsylvania are saying no thank you. And you know what? You know what, Ferris? Because I know you're intelligent. And by the way, there's an envelope here. You won something. You are right on the ball. and I got to let producer Nick have the next couple minutes, but let me say that $16 million is awful attractive to the small state of Connecticut to be up and running with a connector, isn't it? I mean, it wasn't like...
Say no, is anyone saying no thank you?
Yeah, $16 million the federal government enticed our little state and said, be the first to lead the way, and here's a heck of a helping head start. So it by no means is... Well, we're gonna wrap up this, and I'm gonna actually beg you to call in a couple weeks because we're gonna do a full-blown health insurance exchange talk show. It's gonna be called Travel. What's that ESPN you like? It's called Sports Center. Mm-hmm. Yeah, this is going to be called Exchange Center. I'm going to have Kevin Cunahan and Victoria Veltri here as guests. So Ferris, save your fire for a couple weeks. I'll shoot you an email.
Mike, but it sounds like we sold out.
Oh, we sure did, unfortunately. All right, I got to let producer Nick. He works real hard. I'll talk to you in 2 weeks. That's Ferris, who I admire, intelligent guy. All right, Nick, run away with it, kid.
All right, I'll take whatever time we have left.
You got all of it.
If you'd like to watch previous broadcasts of Medicare and You, then you can go a number of ways. You can head to www.watr.com, and if you scroll down to the bottom, there's a big red YouTube icon. If you click on it, it will take you to the WATR YouTube page. That's where all the videos are found. Or you can go online to www.youtube.com, and in the search box, type in Medicare and You, Michael Regan, WATR, and the videos will pop up.
Actually, other people are telling me they can literally just type in Medicare and You, Michael Regan. But we want to plug our radio show here. WATR is preferential. We have over 90 episodes. It's rocking the house. Mm-hmm. And to be honest with you, he's such a brilliant guy. He makes it look easy. There is no way you sitting on your couch listening could produce these kind of videos. It's I remember a couple years back when we were talking, and you're like, well, I could do it a shoddy way or a good way, and I think you went to Best Buy, and we just decided to do it right the first time. We bought the good cameras. And
yeah.
Is there anything you need for Christmas from Santa over here?
No.
Any new toys we need?
No, I'm pretty good. We're still, right now we're tiling my kitchen. Like the needs I have right now are all right, like decorating the house and trying to.
I'll make sure
put the cabinets back in the kitchen. But my uncle's tiling our kitchen. He's doing a great job. But
nice.
No. Also, if you have a question for Michael that maybe you're a little gun shy, don't want to call into the radio show, you can email the show at WATR Medicare and You, all one word, at gmail.com. I handle the email account, and I'll pass anything along to Mike that we get.
All right. Thanks so much for listening. Another successful Wednesday. Talk to you in 2 weeks.